The impact of DeepSeek AI. Welcome back to Techstination. I'm Fred Fishkin. Joining us from revolutionary technology healthcare company CareYaya is CEO Neal Shah. Hi, Neal.
Hey, Fred. Thanks for having me on.
Oh, great to see you once again. Neal, before
Good to see
we
you.
dive into your experience with DeepSeek AI, let's give everyone the kind of elevator overview of what CareYaya does.
Sure. Yeah, we're a technology innovator in the field of aging and caregiving. Our first innovation was a tech-enabled platform similar to kind of like what many call Uber for caregiving that has scaled rapidly around the country, helping older adults and their family members find great in-home care and the care being delivered by healthcare-focused college students. We've scaled that from one market in Raleigh-Durham, North Carolina, with a few hundred caregivers to now nationally running it in over 15 cities with 25,000 student caregivers on platform. So one of the fastest growing health tech companies in America. LinkedIn just chose us as like one of the top startups in America in 2024. And yeah, excited to be here to talking about our new innovations, leveraging AI tools to help advance healthcare for the aging population.
Well, you've been leaning into AI to provide this, and we should mention that the service CareYaya is offering really is a win-win for all concerned, for people who need care, their families, and for the caregivers too.
Agreed. Yeah, it's awesome. I mean, I think the caregivers having a great experience, and we see thousands of young people in society caring for older adults in their community, and it's really inspiring their life choices and career choices. Hopefully many will go into geriatric medicine, palliative care, primary care, kind of other fields as they realize kind of like the care for our aging population is a big need. So I think that's been wonderful to see.
And tell us about the role that AI has been playing with what you're doing, what you've been doing with it.
Sure. So before getting into kind of the new innovation that we just built, I'd say AI has been instrumental in just optimizing the CareYaya platform itself. What we observe is the home care industry in America, which is a, 200 to $500 billion industry, if you kind of just count how much the care agencies are flowing through versus also just how much is going in the informal care market. This is a up to $500 billion industry that is very low tech to no tech. And the reason tech matters here is that there's a lot of administrative overhead and just costs that can be greatly reduced. So I kind of draw the analogy to how, SpaceX, if you like look at their rocket launch cost, per kilogram to put something into orbit, they did a step function down, where it went from thousands and thousands of dollars to sub-$1,000, so it's like order of magnitude difference, which means that now you can put a lot more things in orbit. And I'd like to kind of draw that analogy to kind of what we're doing, where the traditional home care industry across the US, due to extremely manual processes and high administrative overhead, is running a care model where the average caregiver in America makes $15 an hour and the average care company charges $35 to $40 an hour. So like $20 of administrative bloat, including kind of like finding caregivers, booking, scheduling, making sure, they show up, having like manual staff go out in the field, doing outreach, doing recruiting, et cetera. And we've used a lot of tech in version 1.0 of CareYaya, we got that $20 cost down to less than $3. Then in version 2.0, version 3.0, we've now gotten all those costs down to less than 50 cents. And that's really being enabled and empowered by AI. And, just kind of taking very large amounts of data to predict, similar to how like Uber would for ride sharing, predict when are people available to provide care, in which geographies, which ones are closer by, who are likely to be a better fit for the person receiving care, kind of like assessing personality algorithmically, looking at ratings and reviews of people to find, kind of better fits and better matches, and basically just streamlining all of those costs way down so that the endpoint becomes, in most cities in America, CareYaya is delivering home-based care at $20 an hour. And the family's like, I can't believe this is the quality, I'm getting, which is like amazing quality at 30 to 40% lower cost than like the traditional kind of low tech or no tech industry. So AI has been really instrumental in our core business. And we've seen like the great impact it can make on just kind of delivering better experiences cheaper. And then it's also inspired us to do other innovations to add services to our platform.
Well, let's talk about what you are doing now with AI and in particular DeepSeek AI.
Sure. So over the last like couple of months, we've been, full speed ahead on building AI tools to address what I view as like one of the biggest crises of our times and probably one of the biggest talking points of 2025, which is what's going on with the health insurance industry and the stunning rise in denied health insurance claims. If you look back 10 to 15 years, right, health insurance industry in America has been around for like 6, 7 decades. And for the better part of most of its history, up until, kind of 2015 or so, on average, they used to deny about 1% of claims. So most claims would be adjudicated and paid, and then once in a while, things would be disputed. Unfortunately, in the last decade, many insurers, due to a combination of like less regulation, significant amount of mergers and consolidation of power, have now started just rapidly denying claims, almost algorithmically. And you'll see articles about this on United Healthcare, et cetera, denying claims upwards of 20 to 25% of claims, depending on which insurer, are just flat out getting denied. Why this is a problem for society and a problem for many of the families we help, and we're observing this broadly across society, is that when you have that many claims denied, most individuals as patients slash consumers don't really know how to fight back. So less than 0.2% of claim denials are actually appealed. Most of them, the patient is either just paying or, unfortunately, many times letting it go to collections and it becoming a bad debt. So yeah, we see multiple problems here, and this goes beyond the broader aging population, right? It goes to I've experienced this during my wife's cancer care. Tens of thousands of dollars of claims were being denied. Experienced this. I see midlife people dealing with this for their kids around autism care and kind of other care. Just claims are being denied left and right, and most of the time people don't know how to fight back because the insurers are using tools like AI, and the average patient doesn't have it. The average clinic doesn't have it. So 400,000 plus independent physician practices across the country. Most of them are overwhelmed with the rapid fire denial of claims. And on average, it costs a practice over $43 to process a appeal to a denied claim. So, we thought this is a great use case of AI. So prior to DeepSeek, we had built a lot of AI models, just kind of like running off LLMs that were out there, OpenAI, Anthropic, and others, and basically use those and then trained our own specialized models to help people dispute and appeal denied claims. And I'll kind of go through the use case there, but if you get a denied claim and you just simply take the time to write a thought out appeal letter back to the insurer who denied it, half of the time you win. So think about that, right? Like huge benefit to you, whether your claim was $300, $1,000, $2,000. Just simply appealing, you have a 50% chance of winning. Unfortunately, for most people, the appeal letter is an intimidating process. If you got denied because of incorrect billing code, CPT code, what are you going to do? Search through databases? You don't even know how that works. And that's 25% of denied claims, or 24%. If you got denied because of incomplete patient info or incomplete provider info, that's something you can do, but many people kind of like, feel that's intimidating. How am I going to do it? If you got denied by medical necessity, that's basically the largest case for denials. Over 40% of denials are due to medical necessity. Now you have to go and find precedents and pull articles from medical journals, find any precedents of, well, XYZ. You can even go through litigation history and find, well, we've proved that this person, based on this disease indication, needs this treatment. But most people find that intimidating. How are they going to do that? So as a result, most people are just not bothering to go through this process. And then the final problem is most people just don't even know you can actually appeal. So we thought, why not build and train AI models to make this as close to one click for people as possible? That just go, to our site, upload your denial letter and any other kind of backup documentation you have around kind of your, health history and, why you need this medication, why you had this procedure, et cetera. And then just let the AI figure it out. And, guess what? The AI can do that in 2 minutes, the equivalent of what it would take somebody 3 to 6 hours of research and careful writing to do, and just generate a very well-crafted appeals letter. So that was our kind of like our innovation. We launched that in, kind of late December, early January. And, that was great. And we had gotten the cost, at average clinics, and there's a report from the American Hospital Association that showed that it's costing them about $43 per appeal to process this manually and get people to kind of like write well-crafted appeals letters. We had gotten the cost down to 12 cents. So we thought, okay, this is a huge breakthrough. And frankly, I would say better quality, right? Because like in things like pinging billing code databases and fixing and putting the correct billing code, the accuracy is like sky high through the roof, like close to 100%. So and then of course in medical necessity, the accuracy gets better the more you train it. So we've gotten the cost way down. Where I'm very excited about DeepSeek and models like that, and just like this whole idea of open source, is that the cost went down by a further 90%. So now the cost is nearing 1 cent. So, think about the impact on that. Now you can just programmatically appeal thousands and if not millions of claims for next to nothing. So I think I think it's one of the more exciting innovations that, I've at least seen the opportunity to be part of in a long time.
Who can make use of this, Neal?
Right now, we're offering free to patients, so anyone, and we actually, beyond CareYaya, we kind of just incubated it as its own startup. So we're going to kind of like spin it out and launch it standalone. We call it Counterforce Health. So anyone can go to counterforcehealth.org and use our free AI tool to just create an appeal letter for their own denied claim. So free to patients. Over time, we see a huge opportunity for independent physicians practices. Like I said, there's 400,000 physician practices across America. This doesn't just go to geriatrics. This affects everyone. So everyone from radiologists, neurologists, pediatricians, GI docs. I mean, kind of you name it, they're all dealing with claim denials. And what's interesting about the physician practices is many of them reaching out to us saying, hey, this is a huge revenue cycle management issue for us. When you have hundreds of patients that you're seeing every month getting denied claims, of course, that's a relationship between the patient and the insurer, but ultimately it's also a payment relationship to the doctor. And if you did a procedure, gave a medication, gave a treatment that then later the insurer rejected, you are now on the hook to collect that. So this is something that, people didn't go into the practice of medicine to become bill collectors, and certainly not like debt collectors. So many of these physicians practices, feel the burden of I have to chase down these people to pay their bills when the insurer rejected it. And then they also literally feel the revenue hit because something like 10 to 15% of people will just not pay and let it go to collections, in which case the recovery rates are very low. So it's a real issue where per physician, many practices are losing $3,000 to $6,000 per month based on underlying number of patients they see and how many are being denied claims post-care. So, we think if we can programmatically, even just at a baseline, get half of those won and just like rapid fire appeal, that is a revenue recoup for these practices, in the upwards of $1,500, $2,000, $3,000 a month that they can gain back. So I think from a physician practices tool, this is a real revenue driver and a real financial, kind of benefit. And then from the patient's tool, obviously, it's just a layup, right? If you get appeals one, you collect the money that you're rightfully owed. So I think it's different value from both sides.
Just amazing. So this is open to physicians' offices as well as
Yeah.
individuals.
Yeah, we're actively piloting it right now with several physicians' practices. So if anyone's interested, feel free to reach out. We see denial rates are like sky high everywhere. And we find the smaller the physician practice, the less bandwidth people have, to put staff on this. So most staff, if you have like a billing person in your office, you might be able to help a few patients a week with their claims, but that person has other stuff to do too. Certainly physician, nurse, like they're not going to have the time to allocate to this because they'd rather spend the time on patient care. But believe it or not, despite all that, the average provider in America spends over 25% of their time dealing with insurance. So it's like the administrative waste is nuts here. So if you can kind of like use AI to automate and reduce as much of their time spent on this so that they can have their time freed up to do patient care, yeah, you can see more patients, you can spend more time with the existing patients you have, and on the back end, you can help patients deal with these problems when the insurance company causes the problem. So I actually think that many times the insurance company has broken the relationship between patient and healthcare provider. And I think through something like this, the patient and healthcare provider can be kind of back on the same side against the insurance company. So yeah, I think it's a cool opportunity.
Just amazing, improving lives. What concerns might you have about DeepSeek AI? And there are some who are worried about security with them being based in China. Tell us what your thoughts are.
Yeah, I share those thoughts. I share those concerns. I think that there are some security issues if you're like using it straight through the app. You don't know where the data is going. I'd say, the kind of like the thoughtful thing people should do is because DeepSeek is an open source model, I think that you should use instance of it hosted on American servers. So, whether it's Azure, or, Microsoft, or Fireworks, or kind of other sites, you can ping APIs on those sites who have downloaded and kind of hosted the model, on their site. So you're not hitting up Chinese servers. So I think that's safety number one that I think most people, and you can check openrouter.ai and see which servers are up, and what their costs are, but reasonably cheap. And then second, make sure to scrub data. So for HIPAA, we de-identify all patient data before we send it out to anyone. So prior to DeepSeek, even we were using Anthropic and OpenAI models, and we were fully de-identifying the data, and then just sending kind of what the issue was out to the kind of then go through data and generate letter, and then bring it back, and then our system would add the data back. So I think there's both HIPAA and patient privacy things that companies should be implementing. But I think broadly speaking, people should not be using the DeepSeek versions kind of hosted through the app or hosted in China. But there's ways to access it here. And I think that's the beauty of open source. Funny enough, like, I was thinking about this the other day, like OpenAI, right? Like Sam Altman's company, the whole mission was open source models. And I think that that's benefit to society, and that's how you get cheap, low cost access. And instead, they might as well call themselves closed AI because it's closed, right? It's not open source. They're just kind of sitting on a model. So I think it's really cool that the cool innovation of DeepSeek unintentionally was somebody figured out a way to do this way cheaper and then just open source it to the world so that anyone else can take the model and then run it on their own server and do it themselves. And I think that's kind of like that's awesome. That it's ironic in a way that the open source innovation came from China when it should have come from here. But either way, everyone benefits.
And congratulations on what you're doing with it and explaining it to all of us. Beyond all of this, tell us what your thoughts are, because you're so deep into it.
Yeah.
The impact of AI on healthcare in general, where we are today, and how fast this is going to change everything.
Huge, huge. I mean, I think in our case, and you can see like the papers that have come out on DeepSeek, but when costs go down 90% of anything, usage is going to jump a lot because now a lot more people can use it. So I already thought over the last year or two, the impact of AI was going to be like fundamental shift in the economy, similar to kind of like the impact of what it was like when electricity was invented, that all of a sudden or oil was found, right? If you think about like the Industrial Revolution in America was like, it just so happened that it was really propagated because we found oil as a source of energy, and then electricity. And I think that these things are like, game changing and then of course, not just as these things are found, but as they get cheaper and cheaper, it has a huge tailwind to innovation. And I think healthcare is a very inefficient industry. It's one of the largest industries in the country, right? 20% plus of GDP, the country's spending on healthcare. And our outcomes are not any better than most developed countries. In fact, actually, they're on worse than most developed countries. So I think that healthcare, home-based caregiving, all these industries are massively ripe for tech disruption and innovation. And, you'd already seen over the last couple of years what AI innovation, was taking place. But now the cost of AI just went way down, which means a lot more AI innovation is going to be taking place. I actually think broadly, one thing that gives me optimism is that in the last I was thinking about the stock market, right? Like in the last 2 or 3 years, all of the benefits of AI have been priced into kind of like the top 5 stocks, in the market, right? Like Nvidia, Google, whatever, name it, Amazon, I'm probably missing 1 or 2, right? But, it's assumed that these are the mega stocks that are going to benefit from AI. And then all the other stocks in the country have just kind of like putzed around, right? So the S&P looks like it's up, but it's really up driven by these stocks. I think now, if you kind of think about it, it's exactly the other way, right? Like you kind of realize these guys sitting on what they thought were huge closed positions in AI, that's not going to necessarily be the winner. But now the stuff is more and more available to everyone. So the winner is going to be whoever like builds cool stuff with AI, and brings stuff to consumers, brings stuff to hospitals, et cetera. So I think that's it's like this. I think this news and the significant drop in cost should be like a huge excitement for anyone innovating on the outside. Should be a fear for anyone sitting at Google and Nvidia. But I think it's great for the rest of society because now we're about to get distributed gains. And I think if you use the electricity analogy, when they found electricity, it's like, well, it's not like a few companies that produce electricity won. It's like all of society won because the stuff just got so cheap that people figured out cool things to do using electricity. And I think that this is going to be about as foundational as that.
Wow. Just amazing, Neal. The websites, once again, you want to give them to us?
Yeah, sure. So our care booking website is careYaya.org, CareYaya.org. And then the insurance AI tools to generate appeals letters is counterforcehealth.org, CounterForce health.org. And then I forgot to preview the coolest part of the Counterforce Health thing, which is a prototype we're working on, is a fully agentic AI, like a voice AI agent, Maxwell, that will actually call the insured company on your behalf using all your information and just deal with the claims and billing process for you, so you don't have to deal with the stress and the headache, and will actually respond to questions real time faster, and be kind of your expert AI advocate. So that's another tool. It's in beta right now. Prototypes are available, but we'll be launching that fully in the market in the next few weeks. And same thing, we've been shocked at like how much lower the cost we've gotten on that. So I think agentic AI is going to be a big topic for 2025.
Very exciting. And congratulations on all of the innovations, Neal. We look forward to following up with you. Neal
Great.
Shah, thanks for spending time with us.
Thanks so much, Fred. Really appreciate the opportunity.